Hello, busy moms. This is Tulsi Desai again. Those of you who don't know about me, my name is Tulsi Desai. I'm a physical therapist and I'm also a pelvic floor specialist. So, I have been talking about incontinence lately, but I thought I would talk about something that's also very common, and that's low back pain. I'm sure a lot of you are thinking, yay, that this is for me, because most people, literally most people in this world, they go through low back pain at least once in their lifetime. That means pretty much all of us are going to get back pain at some point in our lives. Um, there are people who have chronic back pain for years or months, and they keep taking medication and they try to take care of the pain in the hope that the medicine will take care of their pain forever. But what medicine does is it is masking your pain. Now, again, let me clarify. There are people who really need medication. So, of course, your doctor will be deciding whether you need medicine for a few weeks or not. But let's go back to pain. People look at pain as something that's scary, but pain is just a symptom, which basically means it's a signal that's telling your brain there is something wrong with this body part. So if your shoulder is hurting, your back is hurting, your knee is hurting, the pain itself is not a problem. The pain is only giving a red flag to your brain that, okay, this body part is hurting, take care of it or protect it, don't move, let's protect that body part. So if you have low back pain, it's just the nerves are telling your brain that, okay, this body part is hurting, and the pain is the way your nerves tell your brain that there is something wrong with this body part. So when somebody tells me I have pain, it's actually not my problem. I don't look at pain as problem. I look at pain as protective mechanism. It's actually protecting you, because if something is hurting, you're going to pay attention to it and you're going to take care of it in whatever possible way you can. Take care of it, but at least you're paying attention, so you're protecting that body part. So I hope that gives you a different perspective on pain, that pain is not a bad thing. I mean, of course we don't want the pain, because that just means there is something wrong with that body part. But I'm not going to be worried about pain itself. I'm worried about what's causing pain, because if you take care of what's causing pain, the pain goes away, because the nerves calm down and they stop telling your brain that there is this annoying sensation that's causing the problem, right? So let's go back to low back pain. So now you have low back pain and you have been taking medication because your doctor told you, oh, you have bulging disc, or you have this, and you take muscle relaxants, anti-inflammatory, pain medication, cortisone injections for in a really bad case, or oral steroids, or different pain patches or creams and balms. So if you have been using it for a long time, how much relief has it given to you? And any of the medication or pharmacological alternatives I have mentioned before, has it completely taken care of your pain and the pain never came back, specifically low back pain? Or has it been the case that it gives you relief for a few weeks or maybe a few months or maybe a year, and then you do something and then the pain comes back? Like, oh, I carried my child, or I was carrying this big box, or I was traveling and I carried like this big bag that was 50 pounds, and I could feel my back hurting, or I heard a pop in my back, and then since then it has been hurting. These are mechanical problems. So there are reasons that are non-mechanical. Let's say you have a fracture, you fell down and you had a fracture, or you had a car accident and since then your back hurts. That's non-mechanical. But what is mechanical? Mechanical is where you carried something in a wrong way, when you bent down from your back and you lifted something heavy, and then since then you had back pain. Or you sit a lot, like engineers or front desk staff, anybody who works in office and they sit for hours and their sitting posture is not good. And I mean, I get patients telling me, oh yeah, I started this new job 2 years ago, and then I have to sit 8 hours in a day and I don't get to take many breaks. So yeah, I'm sitting long time, but then I've noticed since last 1 year my back hurts. Well, why wasn't it hurting before when you weren't sitting for this many hours? So there is nothing wrong with your body, but there is something wrong with how you're using your body. So if you have back pain, you don't remember how it started, it just started and slowly it got worse, most likely you have biomechanical dysfunction, and you can go to a physical therapist and get them have them check your posture, your strength, your flexibility. Sometimes there are certain areas which are tight and you're not sitting properly or moving in a right way, and that's constantly straining your spine and the disc. So that could be, and that can be corrected if you correct your posture, and if you correct the way you sit, stand, walk. A lot of that can take care of the actual reason why you're having all these problems. So I hope this is educational. If you are not sure, if you have any questions, please comment below. If you just give me thumbs up, I won't know whether you're asking me for help or you're just liking my post. But mention something if you need help, or say, I need to talk to you, can you send me a private message? Or send me a private message and I can get back to you. But if you don't clarify that you want to ask me something, just giving me hands up or a like won't really tell me anything. So I hope I'm being helpful, and don't rely on medication for months or years. Medicine is only supposed to help you temporarily to relieve your pain, but it's not supposed to be something that you keep taking all your life. And you shouldn't be bedridden either. There are ways to get back on track and get charge of your life, so you can take control of your life. So please do yourself a favor, go find a physical therapist who can give you a proper evaluation on your posture and strength, flexibility, and hopefully guide you from there. And if you are not, in case if you're taking treatment somewhere and you're not sure if you're getting the right treatment, we can discuss that, and I can kind of guide you from there. But low back pain doesn't have to be part of your life forever. Okay, bye.